So last time we focused on some upper extremity injuries. Today we're going to move down to the lower extremity. So one of the most common lower extremity injuries that I see is of the IT band. So here's a side view of the hip. And then this is the IT band. So it runs from the crest of the hip down here below the kneecap on the outside. So looking at my leg, we're going to run from right here to the hip all the way down. And a lot of times you'll notice it when you have to stand for a long period of time. Pain or pressure will kind of build up on the outside of the knee. Or when you're running, a telltale sign is at the 1.25 to 1.5 mile mark, you'll start to get a lot of pressure on the outside. So one of the best tricks I have for this, for self-treatment, is if you have a baseball or a lacrosse ball or something like this, what you can do is find where that IT band is. So normally if you kind of squeeze the tissue on the side of the leg, when you pinch it, you'll hit both sides of it right here. The big trick behind this is you never want to put pressure directly on the IT band. You want to come from the sides of it. So if I take this ball and I stick it here on the edge of that IT band and just work on extending my knee and kind of work all the way down and then start back at the top and work all the way back down. And you want to come from both sides, so the top and then the bottom, put pressure in and up, and then same thing, just work all the way down to that knee. Kind of like most injuries, you want to give it maybe 2 weeks of trying that, 1.5 to 2 weeks of trying that. If another good rule with an injury like this is if you've attempted something 3 times and you've had to shut the activity down because of that, it's normally a good time to seek some care. So 1.5 to 2 weeks you're dealing with it, it doesn't seem to be helping with self-treatment, or you've had to shut your running down or biking down or whatever the activity is 3 times, then that's a good time to seek us. So give us a call if you need us. Thanks.